you?
on? Hi.
I think we were talking about you the other day. Denise and I think we were talking about you on Saturday. So were your ears ringing? Okay, I'm gonna go back to screen sharing now. All right. Okay, cool. Welcome. So if you haven't popped in the comments where you're from, I would love to know. Put that in there. And we're going to hop right in, get started because I have a lot of information. This is kind of an action-packed little class, and I like to keep it below 30 minutes. So I'm Angela. I think I know almost all of you that are here with us tonight. So welcome and thank you for joining us. I am with Young Living. I've been with Young Living for almost 10 years. In the beginning of 2025, it'll be 10 years. So coming up on that anniversary very soon. And earlier this year, Young Living started a partnership with Clearwater, which is the health share that we are talking about tonight. I learned about it in January, is when I first heard about it, I should say. I didn't actually learn much about it. And I kept hearing about it, hearing about it. And honestly, I had traditional health insurance at the time. And I thought, that sounds too good to be true. And so I didn't actually sit down for a class to really learn and dive deep until July when I was at our company's convention. And I was kind of mind blown and really still thought that's just not real. Like, how can that be real? But I started digging deeper, doing some of my own research and talking to other people and paying closer attention and really finding that people were getting better healthcare options. And so I signed my family up in September and right away started sharing with other people and have been enrolling people since with this program. So I absolutely love it. Super excited to share with you guys tonight. And first one, I kind of dive into some of the most common questions that I get. First of all, what is or who is Clearwater? So Clearwater is a healthcare company. They were established in 2018. Other health shares have been around for a long time, many, many, many years. It just hasn't been as popular until more recent because traditional health insurance has become more expensive and is significantly increasing in price. So this is a more cost-effective option for a lot of people. It's not traditional health insurance, but it gives you coverage for healthcare needs that you have. One of the biggest differences, one of the next screens that I'll show you is a comparison, but one of the biggest differences is that it's a nonprofit. And so when you have a nonprofit status, you can't make tons and tons of money. I don't know what the limitations are exactly, but there are limitations to how much profit you can keep in a company or for the owners of the company in order to keep that status. So it's not about money. If you know anything about traditional healthcare or traditional health insurance, it's all about money. I worked in the healthcare industry for 12 years before I left in August of 2020, and it is a racket, to say it nicely. One of the things that I like about this is that it helps you to put healthcare decisions back in your own hands. One of the biggest ways that it does that is that you can go to any provider, no matter which plan you choose that we're going to be talking about tonight, you can go to any provider and get the same type of coverage. So it's not like, here's your list of doctors, choose one of them. You go anywhere and have the same coverages. So it gives you a lot of freedom and flexibility. And the reason that Young Living partnered with Clearwater is to really help to disrupt the healthcare industry and start to change things in America with the things that we're dealing with. Because there's a lot of stuff that we deal with when it comes to healthcare and the challenges of that. This explains a little bit about what a health share is. So, a health share is a community of individuals like ourselves that come together to help cover the medical expenses of other people. So, when we pay a monthly premium, that money goes into a pool to help cover whatever the healthcare costs are that other people have faced or had in that month. Um, then you choose an annual max when you get the medical type of coverage. So you have an annual max that makes it so you're responsible for the first portion of whatever amount you choose. Those amounts with the policies that we have are $1,000, 2,500, or $5,000. And right now I'm on the $2,500 plan is what I chose to do. And I think I'm probably as of January going to switch to the 1,000 plan for a lower max out of pocket for the year 2025. But after you have covered those costs that when you've had a medical situation, then pretty much everything else is covered 100% and shared by the organization. If you have a pre-existing condition, then that wouldn't necessarily be shareable. So we talk about those things before you sign up and enroll. But any of the other typical things are usually covered and there aren't any issues. And I actually have a screen, so we'll talk about the what's covered and that type of thing. This here gives a comparison to traditional health insurance. And for all the years that I worked in healthcare, I always kind of had this feeling in the pit of my stomach because I saw how it was all about money. So that first one is one of the most important. I really, really like that the health share is not for profit, because the healthcare industry is a multi-billion, if I'm not a multi-trillion industry. It's huge in the amount of money and almost feels like the dishonesty that goes on and like working the system, and that. So with a health share, again, open network of provider, you don't actually have a deductible, you only have a max out of pocket. So with traditional health insurance, you're probably used to having a deductible, but then also if something major happens, a catastrophe, you have a much larger max out of pocket. For my family, it was many thousands of dollars, and same thing for a lot of other families. I have one family that's a family of five, and their max out of pocket per individual was $16,000 if something major happened. Can you imagine, like, if they were all in an accident that was, they were together and they all get injured? That would just be really financially a huge burden for them. Um, in the health share, claims are rarely denied because, again, the goal is to keep us happy so that we're paying our monthly premiums and helping to keep the costs down for everybody. And that. So, and again, really giving us control of our health care. One of the things that's really nice is that you don't have open enrollments where you can, sign up or cancel your policy. You can cancel a policy anytime. You can sign up anytime. And what a lot of people don't know, if you are paying for your own health insurance, you can actually cancel it anytime as well, kind of like car insurance. I've talked to a lot of people in the last few months. Are like, oh, I'm actually in my policy until this time. If you are a W-2 employee, it might be challenging to make adjustments, but you can cancel. So I like to share that as well. If you're in a really expensive plan and this is better for you, you can cancel. um, this is my family's example. So on one of the later slides, I'll be showing you guys that you look based off of your age. So it's a specific category. So we fall under the age category of 40 to 49. My husband Garrett is 47 years old. And this shows our monthly premium when we had health insurance. It was $1,560, and that was for medical and vision. With the health share, we now pay $955 per month. And this is some of the comparables that were important to me. For example, for our chiropractic visit, we got 12 visits a year, each of us, on the health insurance, and now we get 24 visits a year. And it can also include, or it does include, acupuncture. So those 24 visits can be my choice. How many of them I want to go to a chiropractor? How many of them I want to go to an acupuncture? It also shows you the comparable on my deductible and then also my max out of pocket. And you can see with the health share on the right side, it's the same amount because it is not the health insurance. So the same amount for each of the columns. One of the things that was never covered in with my health insurance was IV drip or supplements. So my supplements from Young Living that I've been buying every month for 10 years almost, have never been covered. Now they're covered because I got the holistic plan option. So I have medical, vision, and the holistic coverage, which gives me a lot more options. Telemedicine and telehealth are both free. Some insurance companies or businesses have a benefit where you can get telemedicine for free and or no out-of-pocket charge typically, but telehealth is something that's a lot less, for mental health, is a lot less common. So I like to point that out because that's pretty valuable to some people. Now there's three different types of plans. So the first one here on the left, ClearShare, that's for major medical coverage. So if you want medical coverage for large things like maybe being in an accident, going to the emergency room, a broken bone, or major surgeries, those kinds of things. That's what that's for. And with that one, that's where If I've sent you the questionnaire, I have a little questionnaire that I have people fill out. If you have pre-existing conditions, you wouldn't necessarily qualify for that. So pre-existing conditions might be like cancer, a recent heart attack in the last 5 years, or being treated for heart conditions in the last 5 years. If you're still like on a medication or have to go for regular visits to make sure that you're okay and under care, that would be something to look at. So if you have a specific situation that you question, we can definitely dive deeper and look in that. If you want to comment here, you can post it in the comments and we can chat about it, or I can connect you with my benefits expert. She does a lot of like one-on-one consultations for me. She's really good. The next column is holistic. Anybody can get holistic care. So even if you have a pre-existing condition, so let's say you're somebody you know or somebody in your family that you want to have coverage for is currently going through cancer treatment. A lot of times when somebody has a major health situation or scare, they become more aware or conscious of holistic options, being proactive about their health, and anybody can get this. So if you, again, if you have pre-existing conditions, if you are over the age of 65, then you wouldn't qualify for the medical, but you could get the holistic. And we'll look at that. Within the holistic column, there's two different options, but this is something that even some people, like say maybe you know somebody who has traditional health insurance, they are an employee and their company pays for a large portion of it, then it may not be very cost effective to get the medical through this, but they can still get the holistic and have it as like an add-on or a separate policy that they're using to get good coverage for those other holistic options. Then the other option is to combine them to get the medical coverage and the holistic coverage. This is most common for people who don't have insurance, own their own business, is somebody who's maybe like a 1099 employee. So a lot of real estate agents that I've been doing comparisons for, or mortgage people, mortgage brokers, that type of thing. Those are really, really common. The small businesses that I've been talking to are mostly people who have fewer than 50 employees because laws are different in the state of Washington after you have more than 50 employees. There are still options, but it's just looks a little bit different. I changed the healthcare benefit that I offer for my company. We own a roofing company as well, and I changed it for them. And so I've worked with my CPA, my bookkeeper, and our legal team to make sure that I set it all up properly. And so if that's the case for yourself or someone that you know, I can guide you guys through that because I did a lot of work to make sure I did it properly because we have unique laws in the state of Washington. So this here shows what is covered by ClearShare. And I know the screen is small, especially if you're joining from a phone. So I am actually going to read through the list tonight. I haven't before, but that was some feedback I got. So again, remember, I mentioned it a couple of times, but this is super important. If you're taking notes, this is something to write down. There's no network. You go to any doctor that you want. They cover accidents, emergency room visits, hospital services. They've got the telemedicine, so 24/7, 365 days a year, the mental health sessions for $0, care coordination. This is if you have a known or planned surgery that is coming up. This is a specific department to help you research and make sure you're getting the best price. For example, one guy, I can't remember if it was a knee or a hip replacement that he needed. I got to find out and that because I was trying to remember a couple weeks ago as well. But he knew he needed the surgery and he was going to go to his doctor, have it done at the hospital, and it was going to be $80,000. So he was going to pay his out of pocket amount. I think he had the $5,000 one. And he then the rest of it would be covered and shareable by the network. And he used this care coordination department. They discovered that his doctor does surgeries in a surgery center local to him as well. And the cost at the surgery center is only $40,000. And so he obviously scheduled it there and switched to having it done there. When you use the care coordination department and they can help save money, it also waives your annual max for that service. So for him, he didn't have to pay anything because of the greater that he saved for the whole group. So obviously saving $40,000 of our monthly premiums to go towards other things. So that's a really, really big deal as a part of the department that they have. It also covers pregnancy and postpartum, whether you're giving birth at a hospital, birth center, home birth. It covers home health care, pain management injections, hormone therapy injections, medical supplies, nutritional services, international medical treatment. So, this again, if you're taking notes and you travel out of the country, this is a big deal. So, when you travel out of the country, a lot of times, well, your health insurance doesn't travel with you. You have to buy special insurance so that you're covered if something happens to you. The health share goes with you and you would still be taken care of and it would be covered. So that's a really big deal. Occupational therapy, physical therapy, speech therapy, massage therapy, inpatient and outpatient hyperbaric therapy, durable medical equipment, so DMEs, skilled nursing facilities, hospice, and weight reduction. So again, lots of things. There's two ways that you can get massages covered. On the medical plan, if you have a need and a doctor writes a prescription for you, it's up to $3,000 in a year that can be covered. But when I talk about the holistic plan, I'll talk about that as well because it can be included as an add-on for a chiropractic visit and covered that way. So this shows in the holistic option. So there's, like I mentioned, there's two holistic options. There's a full holistic option that's more detailed and has more coverage. And then for people who want to have savings and don't need as much or go to using as much of the services, then there's a what's called holistic savings option. So in the holistic option, as an individual, you get reimbursed for $50 worth of Young Living essential oils or supplements, anything of your choice. It doesn't matter what it is. You can't buy a diffuser and get reimbursed for it, but any essential oil, any supplement is covered. If you're a couple or a family, then it's $75 a month. So that's what I get reimbursed each month. Primary care visits, you would be able to go to a naturopathic doctor, an MD, a DO, so an osteopathic doctor. Really, any of the doctors that you want to go to are pretty much going to be covered. And when you do something on the holistic plan, so any of the items listed here, when you go to that appointment, you pay for it, you get a receipt. You submit it on an app. It's super simple. When my family went to the chiropractor on Saturday, and I submitted all of them within 10 minutes. So it's a different submission for everybody, and there's 4 people in my family. So that's something to be aware of. And I'm going to give you an example in just a moment on that. But also, breast imaging is covered in this. And again, this is going to be something that's different than traditional health insurance. You can go for a mammogram or thermography. Mammograms are typically covered by traditional insurance. Thermography is not. When I went for thermography, it was between $300 and $600, and I did it a couple of times as I have hit the age of 40, and I paid for it cash out of pocket. It was never covered by my insurance, so I'm super excited to have this coverage now. Um, the next two are chiropractic or acupuncture. So again, on this plan, it's 24 visits in a year. And Dr. Lael and Dr. Paul are my chiropractors from Brilliant Life Chiropractic. She's on here tonight. And we went, as I said, on Saturday, my whole family. And I want to share the example of mine and what my reimbursement is. So I went, had my adjustment, it was $60. And then you get add-ons covered up to $175 per person per visit. So there's this supplement that I like that Young Living doesn't sell. It's a different company. It is LMNT. So it's an electrolyte supplement that has sodium, potassium, and magnesium in it. And I like these because you add them to warm water. It's chocolate mint, chocolate chai, and there's another one. I think I got caramel. But I bought 2 boxes of this. And then I bought individual ones. So I think that I got like 70 of these little packets for us. My total bill for myself was $163, and I will be reimbursed $128. I submitted it on Saturday afternoon after I got my invoice, and it's already been acknowledged, and that's what I will get in my bank account. I haven't got it yet, but I do it all electronically, so it should be there next week if it's not by the end of this week. So pretty fast. Typically, they say 2 to 3 weeks for your reimbursements, so that's what I like to tell people. But I got one of my reimbursements for my essential oils earlier in the month. I got it within 7 days. I placed my order on November 1st, and it was in my bank account by the 8th when I checked on it. I was like, wow, that's fast. So it is when these are the holistic things that you're doing. The reimbursements are fast. It's a very simple process. You just take a picture. Like I saw Dr. Paul on Saturday, and I just literally took a screenshot of the receipt that he emailed me, and it was easy to upload because I do it from my phone. So when you go to those visits, you're rarely, I mean, if you're going to a chiropractor and getting like adjustment or not adjustments, x-rays or like a new patient exam, then it's probably going to be obviously a lot higher and maybe closer to that amount of the max reimbursed $175. Um, but typically not. I mean, $40 to $60, maybe 75 is normal chiropractic visits. And so any of the add-ons that you get at that same visit are what's going to help you to have more that's going to be covered. Red light therapy, massage. This is a great way to get massage covered. And then again, anything else that you're buying from your chiropractor, you just make sure that it's on the same receipt. So your chiropractic adjustment plus all add-ons reimbursed up to $175 and your responsibility is $35. So the total bill can be $210 and you get 175 of that back for 24 visits when you have this plan. And then IV drips, if you are on a medication, generic medications cost $0. Again, different than health insurance. A lot of health insurance, it's like $4, $10, or $20 for your generic medicines. If you have a name brand prescription, it's on a case-by-case basis, depending on what it is. Then this one here, the holistic savings. The differences here are that you don't have the um, prescriptions, you don't have the breast imaging, and the chiropractic or acupuncture visits is not 24, it's 12 visits per year. So you could go to the chiropractor 11 times and the acupuncture once, and that's your 12 visits. It can be any combination that you choose, but this one is something that is an option for somebody who doesn't want to have all of the other visits that they're paying for on their monthly premium. I do love, I know I talked about it already, but I do love that I'm now getting reimbursed for part of my Young Living products that I purchased. So $50 a month for, when you have an individual policy, or 75 when you are a couple or a family. So my family's getting reimbursed $75 a month on that holistic plan. One of the things I do like to point out is that receipts do have to be submitted within 30 days for that reimbursement. And then here is the pricing of the plans. So I know it's small. I've tried to reduce and adjust these screens so that it's a little bit bigger, but it really, if there's something you want me to point out, you're welcome to unmute and I can share with you. So this one's the Clear Share for medical only. Now, you can choose who you want to have covered. So one of the questions that I've been asked is, do you have to cover everybody in your household or everybody in your family? No. If it's only you that needs health insurance, then you can get it just for yourself. Actually, the last three people that I've signed up live in a household with multiple people. One is the husband. He's the only one that signed up because his wife actually works in the medical system and her insurance is, I think, almost 100% covered. It's not a very good policy, but it's almost all covered. So she's dealing with it currently. Another one is the wife, and she's the only one that signed up. She got the medical and the holistic, and then another female that lives with her family, and she was the only one that needed it. So it just depends on the person and the situation. You can make adjustments. Like if you get medical today, then in 2 months, you're like, oh, actually, I really want to be able to go to the chiropractor more. You can add on holistic. You can cancel it anytime. It's totally flexible. And again, it's one of the things that I really love about it. So when you're looking at the different categories, you can see there's 3 columns, and that would be based on what your annual max is that you're choosing. So if you have a $5,000 annual max that you're willing to invest, obviously your monthly premium is going to be less. And then it gets a little higher as you go to 2,500 or 1,000. Okay, go to the next one if there isn't anybody with questions there. So if you do holistic only, this one shows if you're single, if you're married, if married with kids, the different categories here. So again, this is great for somebody who has a pre-existing condition, over 65 years old, or has health care that is very cost effective because of whatever reason. Maybe they're military or something like that, but they don't have the holistic plans. I actually have an optometrist that I was just talking to yesterday who has full military benefits. But he's like, I don't really ever go to the doctor because I'm not going to go on base. And so he's like, I really want something that allows me to go wherever I want. So he's actually looking at paying for his own plan, and he's planning to do medical and holistic coverage. So, cool. Next one. So this one is when you get the combination. So this is if you want medical coverage and the holistic savings option. So this is the one where you had the fewer chiropractic visits. I want to make sure I give you time to see it or zoom in if you need to on your screen and that. Um, and then this one I switched to is the holistic and clear share. So this is the full holistic that gives you the 24 visits, covers the breast imaging, the $0 generic prescriptions, and it gives you the medical coverage on this. And another thing that makes this different than health insurance, when you do health insurance, everybody's just kind of in a pool for most health insurance policies. There are some that look at specific age ranges, and if you're younger, you get a cheaper policy. But most of them are not that case, especially if you are like a small business or one or two individuals, just your family, small family type of thing, then it's typically just kind of a set fee and it's pretty high because the goal is to make sure that they don't lose money. With this, it really truly looks at it. So the younger somebody is, the more cost effective it is. When somebody's in that older age range of 50 to 64, I can typically still save them money. It's typically, well, for anybody that I've done comparisons on, it's been between $20 and $60 a month on their premium, but it typically is still significant on their out of pocket costs on the medical. So, for example, one person, I think she's 59 that I helped, she had a deductible of $8,000 and a max out of pocket of $20,000 per year. And she switched to the 5,000, say 5,000 annual max, saving $40 a month. But she always was like, if I ever have anything, like I've always been worried that it's going to cost me a lot. So she's saving a little bit on her monthly premium, putting that in a savings account so she can start building it up and know that she has $5,000 or she's working towards having $5,000 in a savings account that's just for medical in case something does happen. So that was something that was important to her. I like to point that out that there are typically still options for people that are in that older age range. For people who are younger, it's mind blowing. I mean, even for us in our 40s, and we're saving $600 a month. I have another family that is a family of five. General contracting company, small business. They're going from $2,200 a month to, depending on which option they choose, either 1,000 to 1,200. So they're going to be saving somewhere between 1,000 to $1,200 a month and getting more coverage. She doesn't have chiropractic, acupuncture, those types of things. Her prescriptions, she has a couple of prescriptions that they had recently. They were like $20 for generics. So again, saving them a lot. There are vision and dental options. As I mentioned, our family did the vision, but we didn't do dental. We have a pretty good dental plan that was a little bit better than this one for like $30 a month and that. So I stuck with that plan
Angela,
for, yes,
can I ask you a question?
yes, ma'am.
So is the maximum age that you can be for this program 64 years old?
For the medical side, yes.
Hmm.
For the holistic side, there is no age range. But if
Okay,
you want the medical coverage, yes.
gotcha. All right,
Yes.
thank you.
Good question. And I think the reason behind that is because most people at age 65, or at least some, I don't know what percentage of the
Go
population,
to
will,
Medicaid.
yes, so they'll have Medicare or Medicaid.
Right, okay,
And so then this would only make sense for them to be an add-on because that is typically pretty cost effective for people. So I have two people that are doing the holistic and they have Medicare that are
gotcha.
of that age range. I think one of them is 69 and the other one's like she's quite a bit older. She's in her upper 70s. So that's what a couple of them are doing. So it is still an option in that setting. Great question. Thank you. Any other questions right now? Cool. So how it works is that, again, as I mentioned in the beginning, this is a partnership with Young Living. So if you're already a Young Living member, it's super easy on the site where you log in. There's a place that you scroll down to and you can click on it to join. I can also send you a link so you can message me. And it's super simple, but this is administered by Clearwater. So Clearwater is the company that has the health share. And then whichever plan you're going to get, you sign up for that through Clearwater and you make your monthly premium payment to them. That's where you submit for your reimbursements and that kind of thing. One thing that I didn't mention that is also very important that I want to point out is when you have the medical plan, you aren't paying, like, say you have something like a surgery, you aren't paying cash for the whole thing. So, say you have a surgery on your elbow and it's $10,000. That's probably cheap, but just as an easy number as an example. And let's say you have the annual max of $1,000. That for that surgery, you would pay your $1,000. You would get a receipt for the whole thing, and then you would contact Clearwater to open a claim. So it's different than the holistic. For the holistic things, you pay for it, you get a receipt, and you submit that receipt. For something major medical, you go to the emergency room, then you get an invoice and you submit it. So you do a little bit of the paperwork that you're used to having a doctor's office do with traditional health insurance. But if you're saving hundreds of dollars a month or thousands of dollars a year on a premium or on a out of pocket costs, I feel like it's worth it because again, like I said, it's been super simple for us so far. And I every month have either like gone to the chiropractor. I've always submitted my Young Living receipts, and it's been very simple process for us so far. So, any questions? So last thing that I'll explain is that if you were ready to sign up, you could sign up either now through the end of November. So by November 30th, you would sign up. Your coverage would then be active on December 1st, and your first monthly premium would be due on December 10th. It's right around the 9th or the 10th. So they take it out of a credit card or a checking account, whatever you choose for your payment and that premium, and your coverage begins before your first premium is due. So again, I like that. You get your welcome email, then you get actual cards in the mail. So like if you go to the emergency room, you have a card that looks like a health insurance card so that they would see that and you know, give you and services and that kind of thing. So super simple, super easy type of thing. Any questions?
I do have one quick question.
Yes.
I was wondering about the massage therapy that's covered under the Clear Share plan, not the holistic. And I
Yes.
think you said there's a max of 3,000. Does the
Correct.
reimbursement on that start after you've hit your out-of-pocket max? I would
Yes. Oh,
assume
yes. So
so,
great
but
question.
yeah.
Yes, that is the case.
Okay,
Yes.
perfect. Thank you.
Good question. Thank you. Any other questions? I am going to check the chat. Awesome. Okay. Oh, cool. Lori unmuted and asked that question as well. Okay, cool. Lael, you did too. Awesome. So I think that I've answered all the questions. So really the next step, if you're ready to move forward, would be to for us to just chat and message you. Again, it's a different link. If you don't yet have a Young Living account, you'd set that up first to make sure you got this pricing as part of the partnership, and then we would get you enrolled in that. If you have specific questions to, based off of like pre-existing conditions or that kind of thing, we could address those. And otherwise, I appreciate you guys being here tonight. Thank you very much. And I will look forward to chatting with each of you in the coming days. Feel free, I'll stay on for a couple of minutes. If there are any other questions, I will be here in case you want to ask anything one-on-one.
Thanks, Angela.
Thank you guys. Appreciate you.
Thank you.